Now, as we report on the number of coronavirus cases, it's easy to look at the numbers. However, there's a name behind every case. Yesterday, I spoke with Chanel Thompson, a patient in the COVID-19 unit at Nebraska Medicine.
If you're not feeling good, you're exhausted, you have a little pressure in your chest or your head, is isolate yourself and then get help when it's time.
Chanel Thompson, a 48-year-old Bellevue resident, says there is a range of odd and tricky symptoms with COVID-19. She's experiencing fatigue, sinus pressure, loss of smell and taste, and shortness of breath.
And then, when you can't breathe, that's a bad feeling. And then I think the other fear that I have is long-term lung damage because they don't really know. But I have faith in God and I'm not going to worry about it.
Thompson noted that she also felt achy, as if her entire body was bruised.
Because they were afraid I may need to be, assisted or intubated.
After self-isolating for a few days, she knew she had to go to the ER. For the last 4 days, Thompson has been in the coronavirus unit at Nebraska Medicine. Right now, is it hard for you to breathe?
I'm doing so much better. But I do have some struggling breathing. But I'm sure God will continue to heal me, and that's just going to go away soon.
While in the hospital, she's had a lot of time to reflect, and she wants people to take this virus seriously and to simply be a good neighbor.
And even though for you, perhaps it's not a threat and never would be, or even to your children or your spouse or anything, there are people out there who it's real, and it's very scary.
Now, after our interview, she told me, quote, "Practice your love for fellow man," meaning if you don't like the idea of social distancing, do it for others. Now, she believes she is on the mend and is excited to get out of the hospital soon, hopefully. She had a great attitude.
Hi, my name is Jasmine Brunson, and today I will be talking about the symptoms an infected person with the coronavirus may present. The coronavirus has claimed the lives of many across the world. When it first began, it caused mass panic because the people did not know what it was and they didn't know the signs and symptoms to look out for. So I'm here today to inform the people of those signs and symptoms and what they should be looking out for. The coronavirus is a virus that can infect animals and people. So if a person that is infected coughs or sneezes into the air and someone who isn't infected walks through it or inhales it, they can be infected. Another way they can be infected is if an infected person coughs or sneezes or touches a surface and someone who isn't infected comes behind and touches that same surface, they can be infected. A fever is the body's natural response to kill off whatever is invading the body. In this case, it would be the coronavirus. The body spikes a fever. The body spikes a fever and tries to kill it off. A normal person's body temperature ranges from 98.6 degrees Fahrenheit, but it's not the same for everybody because everybody is different and we all have different body temperatures. A fever for an infant would be anything that is above 100.4 degrees Fahrenheit. A fever for a child would be anything that is above 99 degrees Fahrenheit, and a fever for an adult would be considered anything that is between the range of 99 to 99.5 degrees Fahrenheit. There are multiple ways a person may take their temperature. They can take it orally, which is under the tongue, axillary, which is under their armpit. They can take it temporally on their forehead. They can take it rectally. There are many ways that a person can tell if they have a fever or not. Another symptom a person infected with the coronavirus may present is a dry cough. And a dry cough is just when you cough and it's dry. There's no mucus that comes up with it, no phlegm that comes up with it. And it may feel as if something is itching or tickling the back of your throat, and it just causes you to let out this very loud cough. It may sound like barking. It can be very hoarse and uncomfortable. The person may develop a sore throat. It could be painful for the person to swallow and eat foods at this point because of the pain from their throat. And it can be caused from all the coughing that the person has been doing or from the virus itself, because it is common for a person to develop a sore throat if they have been infected with the virus. A person with the coronavirus may also start to present with fatigue, where they have a significantly lack of energy. They may feel extremely tired, very weak. They may not be able to keep up with their daily activities like they used to. And this could be from the body constantly in a battle trying to fight off the virus. Your body uses a lot of energy when it is trying to fight off a virus. Sugars bring your body energy, and usually when a person is infected with the virus, they have increased blood glucose levels. Well, if the person isn't feeling well and they're experiencing a lot of nausea and vomiting, they're not going to be eating like they usually do, so their body isn't getting enough sugars, and it's using it up to fight off the virus. This puts that person at risk for experiencing the side effects of hypoglycemia, where their blood sugar levels are low because they're not eating and their body is using up all of the sugar for energy. They can start to experience shakiness, sweating, chills, feeling clammy. They may start to show signs of confusion, and they may get lightheaded or dizzy sometimes. And it is important for those to check their blood sugars often, especially if they're diabetic. Another symptom that people infected with the coronavirus has complained of are headaches. And headaches can be from the coronavirus itself, like directly related to the coronavirus, or it could be due to the lack of sleep that people are getting that are infected with the coronavirus, because maybe they're up all night coughing, and they're not getting good sleep at night due to the coughing or the sore throat or other symptoms related to the coronavirus. The coronavirus affects the respiratory tract, and we know that this virus can be transmitted through inhalation. And when a person inhales this virus, they can very well get a viral sinus infection where it infects their nasal cavity lining. And there have been common reports of people losing their sense of smell and their ability to taste things, and this is a well-known symptom of the coronavirus. The coronavirus likes to make its home inside of the lungs. It likes to live inside of the lungs, and it can lead to bilateral pneumonia. And when a person has pneumonia, their lungs start to fill up with all this mucus and this gunk, and it makes it hard for them to breathe. Their lungs won't be able to fill up with oxygen like they need to. They won't be able to breathe at full capacity, and they'll feel like they're having shortness of breath. The oxygen is not able to pass through the lungs like it should and re-enter the blood, and that's what causes their feeling of shortness of breath. It can feel like they have a very tight chest. Breathing can become very painful for these people, so they don't like to take the deep breaths, and which can cause further complications. These are some of the more serious symptoms of the coronavirus that people in the healthcare setting may see. So if you see your patient becoming a little bit more confused, or they're starting to become really hard to arouse, they may have a buildup of carbon in their blood, and this could be due to the impaired gas exchange. They're not breathing off the acid like they usually do. So this would be the cause of the confusion and the hard arousal. Another thing they may see are the bluish around the lips, fingers, and toes. And again, from the impaired gas exchange, the oxygen is not flowing through the lungs to the blood like it usually does. So you may start to see cyanosis in your patient. If these symptoms of the coronavirus aren't addressed, it can be fatal for the patient. It can go into multiple organ failure, they can become septic, and they can even die from the coronavirus. So it should be taken very seriously. The coronavirus does mimic the symptoms of many other viruses. So it is very important that if you are experiencing any of the mentioned symptoms in this video, that you go and you seek medical attention and follow the guidelines that are put out there for your safety, and stay home.